My assignment was to introduce the commissioner and be brief and not take up her time. I saw the commissioner last night at dinner and asked what she would like for me to say, and she said, well, it's in the program. They can just take a look at that. So I do want to call attention to your program. I will certainly not read this to you, but what stuck out to me in looking over the commissioner's brief bio is that she obviously is a person with a deep sense of dedication of service and civic responsibility, starting off working with newborns and with many human service type programs. You draw the conclusion beyond a doubt that she has a compassion for people. She has vision, or she would not have been the executive director of Envision 2020 for some 17 years. What you do not see written down, that you can't capture in the black and white of a piece of paper, is a passion that she brings to the job. And without that passion, there would be no way for success. And without saying anything further, I will ask you to join me to welcome Commissioner Beshear, and you'll hear some of that passion when she speaks.
Well, good morning. Last April, I spoke to a group up at Children's Hospital. It was the Leadership Alabama class, to tell them about the work that we were doing in the River region to increase access to mental health care. And I started off by saying to them, I hope you realize that you're on sacred ground when you're at Children's Hospital. Well, that's the way I feel about this room today. I could just bust out crying, I'm telling you, but I'm gonna not do that. I am gonna try to share a little bit, and I know that my time is very limited. So you're not gonna get a lot of detail here today, but because many of you don't know me or haven't met me, I feel like it's important for me to share with you the passion, as Dr. Dill said, that I bring to this work. So here we go. First of all, I think it's important for me to say that I am the 4th commissioner in 5 years. And for the staff to have that degree of uncertainty and still keep moving forward is commendable. And I appreciated earlier somebody commended the staff. And I want you to know that when I walked in that day and they said, hello, Commissioner, I felt like I had landed in a foreign country with a foreign language. Yesterday marked the 6-month anniversary of my being sworn in. And these people have been tireless in their efforts to educate me, support me, and take care of the people that we serve. I'm so proud that they're here today, and I want to ask my senior staff to stand up so that y'all can see them, and then any other. And then I think earlier we recognized the other individuals in our department. Okay, so I arrived in the midst of a little bit of uncertainty. We decided what we needed to do was go off and have a crucial conversation among our senior leadership, and that is what we did. And during that time, we came up with our 3 words that are our mission. It is our mission to serve, empower, and support. And then our vision is promoting the health and well-being of Alabamians with mental illness, developmental disabilities, and substance abuse. Those are the 3 divisions in our department. Although mental illness and substance abuse are now under 1 division, but they have a very intensive staff focused on each of those. Now, it might be useful also for you to know that I have a guiding principle that I use in all my work, and if you read the program, you know I'm a nurse. I did my psychiatric training at the Dorothea Dix Mental Hospital in Raleigh, North Carolina. I have seen human beings warehoused. I have seen it. Sometimes I feel like we're back in the 1800s because we know the prisons are the largest mental hospitals in our country. This is a tragedy on every level. So, my guiding principle is the only behavior I can change is my own. If I want other people to do differently, then I have to change what I'm doing. And I see that happening in this room. Y'all are educating yourselves, you're influencing. I'm so proud to have all these elected officials here today. The other principle that I live by, again from my nursing training, is everything is connected. You have heard that over and over this morning. Everything is connected. I like to think of it as a system, just like your body is made up of a bunch of different systems that all have to connect with each other for you to be healthy and functioning. So does the community. It is a system. It must connect for the community to be healthy. So that is those are sort of 2 points of view that I bring to this work. Now, I want to very quickly show you some numbers about all the people that we have served and in what capacity over 2017. Thousands and thousands of Alabamians. Despite the closure of the hospitals, have been served in their communities thanks to the community health centers that are here. You know, our greatest challenge in this work is stigma, and so many people have mentioned it this morning. So I think what you're doing here is a huge step in helping to reduce the stigma. It prevents access to care. It's a barrier to funding. It's a barrier to full participation in the community. Now, my good friend Kim Class is sitting over here, I think, at the press table. And she is a reporter here in Montgomery, and she has written, I don't even have any idea how many articles. It's a stack like this about mental illness and about the work that we were doing in the River region. So after I was sworn in as commissioner, I was invited to speak to the Alumni Association of Leadership Montgomery, and Kim was there, and she wrote an article about it. She says, Beshear, mental illness is a disease. Now, it's kind of surprising that that would have to be a headline, that the commissioner declared that mental illness is a disease. But there you are, and I have it, and I'm so proud to show it, because now we have evidence that mental illness is a disease, and we have to treat it as such. Okay, let's see, next slide. As I think about this work, I sort of had this structure in my mind about how to organize it. And so one of my big goals is right up there at the top. I want to make this department relevant to every person in this state. I think often people just see this big building up there at the end of Monroe Street, and it's scary, and there are a lot of rules and a lot of barriers, and we're trying to break that down. And the best way to do that is through positive working relationships. So, mental health department, relevant through relationships. Underpinning that, at the base of that, of course, you have to have partnerships and you have to have planning. And so I want you to start there at the left. The first pillar of mental health is prevention and early intervention. We have a couple of things going on in that arena that I'm very excited about. One is the Alabama Early Intervention System under Jane Dewar, who's in our department. We have a school-based mental health collaboration. I'm actually meeting with Dr. Richardson next week, and very excited to have that meeting. We have counselors, mental health professionals in schools through a contractual agreement between the local mental health centers and the local school systems. We have 12 of our mental health centers participating in this, and we have 36 school systems. We need to increase that number. And that also came as a recommendation out of the Juvenile Justice Task Force. So that was exciting to me. That shows a really important connection. And then Governor Ivey appointed the Infant Mortality Task Force. Thank you. I have 5 minutes. Okay, I'll be fast. Appointed the Infant Mortality Task Force, which is very exciting to me. She did it around the issue of opioid addiction. And tragically, we have thousands of babies born addicted from birth. If you intervene early, you can get on top of the neonatal abstinence syndrome and end up with a healthy baby and hopefully a healthy mother as well. So very excited about prevention, early intervention. Next, we have crisis care. I'm excited to tell you that we are going to initiate a statewide Stepping Up initiative. We have 11 counties in Alabama that have signed a Stepping Up resolution. 4 of them are here in the River region. And we are going to take that model statewide. We have identified with Sonny Brassfield, who's with the county commissions, a number of people who will serve on that, and our department is to create an initiating committee that's going to start taking a look at how to organize better at the community level, because that's where people live. That's where people get arrested. That's where they get put in jail, is at the community level. How to organize at the community level to reduce the numbers of people with mental illness in jail. So stay tuned about that. Okay, moving quickly. Housing is my next pillar. Critical to have the housing. Kim Hammock, who came up earlier to answer a question, is going to give you a lot of detail about that, so I'm not going to spend any time on it. Workforce is critical, okay? We heard up here a few minutes ago how there's no psychiatrist available in Pat Moore's area. It's wonderful that we can do telepsych, but it would be better if we could have clinicians, more clinicians. And I want to show you something that's pretty daunting, actually. Okay, right here, this is the availability of behavioral health providers. And up here, that's per behavioral health provider, there's 300 people to every provider. The ratio gets higher, 700 down here. The last bar on my chart is Alabama. 1,200 people per provider. We have a workforce problem. We have a workforce attraction problem, okay? We have fewer people going into medicine and fewer still going into psychiatry. So we have got to be very proactive about how we approach that. The other thing about workforce that I want to emphasize is that we need to be continually identifying the best that we have and training them, supporting them. This is hard work, psychiatry. It's hard work. And we need to make sure that we have the best people possible with the best training possible, and our department is fully committed to supporting that in every way we can. Now, in between, you see a couple of words. Education, we got to do education of the public. That'll help with the stigma. Mental health first aid is an excellent tool. Everybody in the state can take mental health first aid. It's a one-day course that helps you work with a person who appears to be getting into a crisis situation or before the crisis. So our department is taking a proactive stance on mental health first aid, and you've heard about CIT. Don't need to talk about that. This afternoon, you are going to hear from some wonderful people about peer programs. We believe that peers are essential. We believe that peers can make a huge difference when they are a member of the whole healthcare team. So, I hope I came in under my time limit. I know I'm standing between y'all and lunch, so I'm going to say amen to everything that was said this morning, and the time is definitely now. Thank you.
Thank you, Lynn. We really appreciate all that you are doing.